Hello, doctor. Can I get the tramadol for the road? Body they pay me off.
Wait to make I check your body, then I go tell you wait till you need.
Hello, doctor. I know it's the way to wait. I know it's the way to
wait to make I check your body, then I go tell you wait till you need.
Hello, doctor. No need to check me. I know say now waiting my body need. Is it your body?
Wait to make
I don't be wait.
Then I go tell you wait till
I don't be wait. Hello, doctor. You see I am coming. I need codeine or I go enter coffin.
Wait to make I check your body, then I go tell you wait till you need. Give me cannabis, please, I need to end this feeling. Wait to make I check your body, then I go tell you wait till you need.
Hello, doctor. Waiting I do myself. I've been doing the same, but I didn't want somebody.
Wait to make I check your body, then I go tell you wait till you need.
Doctor, help me check my body. I need your help before it's too late. Hi. Gutter, water, handle you, you go just die through it.
Handle,
Bunny, handle
you, you go just die through it.
Ecstasy, handle you, you go just die through it.
Handle,
Bunny, handle
you, you go just die through it.
Drama, handle you, you go just die through it.
Handle,
Bunny, handle
you, you go just die through it.
When cocaine handle you, and codeine handle you, handle. When it handle you, you go just die through it. When black mamba handle you, and ref not show you shake it.
Handle,
when he handle you, you go just die through it.
Handle,
no, wait until them handle you. When they handle you, you go just die through it.
Handle,
Paradise,
handle,
Crystal Metal,
handle.
when them handle you, you go just die through it. If you no feed by cow, oh brother go buy fowl. No matter waiting, you go buy this Christmas must drop yo. I go give you something, and you go give me something. No matter waiting, we go give this Christmas must go sweet. Pepper go day, take everything go stew, flex, carnival everywhere, but them go the share things so. Go there, bone, Ramadan go there, faith. No matter what in them telling you, make you no take a move. Sky, jingle bell, a jingle bell, a jingle just let go. You fix to drink all you can and chop all you can, but you don't have to do drugs. Jingle bell, a jingle just let go. You fix to drink all you can and chop all you can, but you don't have to do drugs.
Don't do drugs, don't do drugs,
don't try it though. He go choke you up. He go steal your sunshine up. He go shock you up. He don't kill him any youth for my area, even for your area. When you start it to stop, it no go easy. As you dey drag am go, he dey drag you down. Water come up from my eyes, oh. When I remember all the guys, oh. When many of them kicking bucket, oh. Some cut to socket, oh. Make we don't forget, oh. Project Toquito, say.
don't do drugs.
Run up you see body, oh.
Don't do drugs.
Run up push your busy body.
Don't do drugs.
If you die, you go sad, oh.
Don't do drugs.
Oh yeah, help me tell somebody.
Don't do
Say, run up you see body, oh.
Don't do
The body, oh.
drugs.
The body, oh.
Brought to you by the National Drug Law Enforcement Agency, NDLEA.
Headquarters of the agency in Jahi, Abuja here. That's the nation's federal capital territory. We'd like to say a very warm welcome to everyone joining us from across Nigeria, wherever you are joining this conversation from today, be you in Northeast, North Central, or Northwest, or even down south in the Southwest, Southeast, South of Nigeria. This is NDLA's Open Forum on Xspace. And we'd also like to welcome all our compatriots in other parts of Africa, Europe, America, Asia, and even the Middle East. Like I said, this is the 123rd edition of this conversation on Xspace. I'm your host, Femi Babafemi. And today we will be discussing another important topic, that is drug abuse, disruptive behavior disorders, and remedies. I bet you are going to enjoy this conversation because we already have a guest speaker who would be giving quite a lot of insights into this particular subject, and would also have compatriots across the world who are knowledgeable enough about this particular issue, who would also be throwing in and sharing some experiences and knowledge as well as information with us. Let's sit back and enjoy this conversation. This is a platform where we share information, knowledge, and even raise awareness about this substance abuse and its devastating impact on human lives, public health, and indeed our environment. We'd also like you to know that this platform serves as a channel of providing help to those who are struggling with substance abuse, especially those who need support, who need treatment. I can tell you that indeed the NDLA has some 30 facilities across the country where people can get support services, including counseling and treatment. That is for those who are struggling with substance abuse. And in a short while, I'll also be telling you about the NDLA's call center, through which people can also sit in the comfort of their homes and get support from counselors, clinical psychologists, as well as psychiatric doctors who work 24/7 at our call center with toll-free helpline. More details on that will come very shortly. I would also like to tell you that indeed this platform is a means for us to update you about all the activities of the agency, especially what we're doing to curb the scourge of substance abuse and illicit drug trafficking, as well as getting your feedback so that we'll continue to improve on our deliverables on what we do to serve you, our society, and indeed humanity better. It's important to also inform you that this conversation is recorded and is streamed live on our other social media handles, especially at NDLA01 on Facebook and at NDLA TV on YouTube. You can always go back, take a listen to the recording, and even share with others. It's important that as we are live at this moment, we can also share the links with others so that that would bring them on board to also be part of this conversation so that they can also benefit from the depth of knowledge and experience that will be shared with us here today. I have a guest already well seated. Before I introduce him, to make his presentation, let's remind you of some of the activities of the agency this past week. That usually comes in our news highlights segment, which will be taken by two of my ladies, that is Netta and Miriam. Netta, let's have the update you guys have for us today. Please go ahead. Thank you.
Thank you, sir. Good day to everyone, and thank you for joining us on this week's Xspace. My name is Netta Wedozier, and here are the NDLEA news highlights for the week. First, the headlines. Engineer in NDLEA custody over illicit drug consignments concealed in pressure machines. as operatives intercept 511,000 tramadol pills in Adamawa, 1,323 kilograms cannabis in Ekiti. Arrest grandma with opioids in Lagos. Operatives of the National Drug Law Enforcement Agency (NDLEA) have arrested a suspected drug trafficker, Egu Philip Inya, who claims to be a building engineer while attempting to take delivery of illicit consignment concealed in pressure machines imported from South Africa. The 42-year-old Egu was arrested on Monday, 2nd December 2024 at Okesin Motor Park, Enugu, when he showed up to collect 3 units of pressure machines inside which were hidden parcels of loud, a synthetic strain of cannabis weighing 7.40 kilograms. The consignment had arrived in Murtala Muhammed International Airport, MMIA, Ikeja, Lagos import shed on 29 November 2024. Following credible intelligence, officers of the MMIA Strategic Command of the agency had monitored the shipment pass through clearing processes up to a logistics company's warehouse outside the airport where it was to be collected by the consignee. The importer, however, changed the point of collection to Enugu at the last minute. As a result, NDLEA operatives in a follow-up operation in Enugu arrested Egu when he showed
Medicine, University College Hospital, Ibadan, encouraging them to take advantage of their profession to enlighten patients about the dangers of illicit drug use, while the Oyo State Command facilitated a similar sensitization lecture to students of Progressive Secondary School at Doha, Hawaii. Sensitized students of Cochin Primary and Secondary School, Warari, on the dangers of drug use. Concluding the WADA activities for the week was the Anambra State Command on Thursday, 5th of December, with sensitization lecture to students of Community Secondary School, Aba, and the Borno State Command to students of Government Girls College, Maiduguri, on the consequences of substance abuse. That's the update for this week. My name is Mariam, and I hand you over to our host, Mr. Femi Babafe.
All right, thank you, then, Miriam and Netta. Welcome back from the news analyst highlight segments. Now, let's remind you about some of our rules of engagement on this platform today, especially this conversation. Please note that when we approve you to be on the speaker's corner, ensure that you remain muted so that there won't be any interference or interruption from you or your background. And until our guest speaker is done with his presentation, and then we'll start calling individuals by their names or their handles and inviting them to make their contribution or ask a question. Please let's ensure that we follow this simple guide so that we all can enjoy the conversation and then have a pleasant time on this page today. Okay, quickly, like as I was saying, we let me talk to us about the NDLA's call center. That is a center that works or runs 24/7. That is every second, every minute, every hour, every day of the week. There we have our counselors, clinical psychologists, psychotherapists, our psychiatric doctors who run shift 24/7 to attend to the needs of those who have questions to ask about the work of the agency, those who have needs, that is, those who who are struggling with substance abuse, have friends or family members who have issues with substance abuse. They don't know how to access help. They don't know how to access treatment. The call center is there for you to call. All you need to do is right from the comfort of your home, just dial a toll-free helpline. You are not paying for the call. It's free. Dial a toll-free helpline. The line to call is 0800 1020 3040. I repeat the number again, is 0800 10 20 30 40. That's all you need to do, and then the needed help will definitely come your way. At the other end, we have our experts who will be talking with you, and I can assure you of the confidentiality of your conversation. So there is absolutely no reason to be afraid of being judged or being stigmatized. These are professionals who will treat you with utmost respect and then bring you the needed help. So please feel free and tell as many as possible that this service is available, and that's it. You get therapy as well as other psychosocial support services through this platform. I can also tell you that indeed for those who may be calling from communities far deep inside, or those who may not be able to speak English or even pidgin English, I can assure you, you can rest assured that indeed this service is also language sensitive, meaning that they can speak with you in any of the three major Nigerian languages, that is Hausa, Yoruba, Igbo. So this is indeed that no one would have any excuse not to seek support or treatment when they are indeed in need of support and treatment. That's as far as that is concerned. Now let's get to the nitty gritty, and that is a formal introduction of our guest speaker today, and that is Dr. Surajuddin Abdul Kadir, a psychiatrist and a mental health advocate. Dr. Abdul Kadir is a dynamic psychiatrist, educator, and mental health advocate whose career has been marked by a profound dedication to improving mental health awareness, access to care, and research in Nigeria. His work spans academia, clinical practice, research, and non-profit leadership, reflecting his unwavering commitment to fostering healthier society through improved mental health outcomes. He earned his Bachelor of Science, Bachelor of Surgery, that's MBBS degree from Bayero University, Kano, Nigeria. This formative education provided him with a solid foundation in medicine, fueling his passion for psychiatry. Recognizing the global dimensions of mental health challenges, he pursued further specialization by obtaining a certificate in global mental health from the University of Washington, that's in USA, in 2022. This program deepened his understanding of mental health issues across diverse populations and equipped him with innovative strategies to address these challenges. Dr. Abdul Kadir currently serves as a lecturer in the Department of Psychiatry at Ahmadu Bello University, that is in Zaria, where he is instrumental in training the next generation of psychiatrists and medical students. He is also an adjunct lecturer at the Department of Pharmacology and Therapeutics, reflecting his interdisciplinary approach to medicine and psychiatry. His dual appointments highlight his commitment to integrating psychiatric knowledge with pharmacological principles to optimize patient care. In addition to his academic roles, Dr. Abdul Kadir is a senior registrar at Ahmadu Bello University Teaching Hospital, that's ABUF. Here, he provides specialized psychiatric care, supervises junior residents, and contributes to multidisciplinary teams managing complex cases. His clinical acumen and empathetic approach to patient care have earned him respect among his colleagues and patients alike. Beyond academia and clinical practice, Dr. Abdul Kadir is the director of programs at the Excel Mental Health Foundation, a non-profit organization he helped to establish to address critical gaps in mental health care in Nigeria. The foundation focuses on raising mental health awareness, improving access to diagnosis and treatment, and promoting research in the field. Under his leadership, the foundation has implemented numerous community-based initiatives aimed at destigmatizing mental health issues and providing support to underserved populations. In summary, he envisions a future where mental health care is accessible, affordable, and free from stigma in Nigeria. He remains committed to bridging the gap between research and practice, ensuring that evidence-based interventions are implemented to address the country's mental health burden. Now, ladies and gentlemen, please join me in welcoming Dr. Surajuddin Abdul Kadir as I invite him now to unmute himself and make his presentation while we take a listen, while we sit back and enjoy his presentation for the next 30 minutes or thereabout, discussing our topic for today, drug abuse, disruptive behavior disorders, and remedies. Please unmute yourself and go ahead, Dr. Abdul Kadir. Thank you.
Thank you, sir, for the introduction. I hope everyone can hear me.
You are very loud and clear. Thank you.
Okay. Thank you. So I'll be talking to us briefly on drug abuse, disruptive behavior disorders, and remedies. In the next 30 to 40 minutes, I'll start by introducing what is substance abuse, understanding what is substance abuse, a little bit of epidemiology of substance abuse in Nigeria, the causes, consequence, and then I'll now go to the second part, which is destructive behavioral disorder. One will predispose an individual to using substance, and imbalance in the chemicals that the brain used to communicate with each other could also predispose an individual to substance abuse. The other dimension is socio-economic factors. High rate of poverty and unemployment increase susceptibility of an individual to drug use. Urbanization and migration of individuals from the rural to the urban area can result to social disconnection and stress, which can further predispose an individual to use this substance. Then we have issue of peer influence and cultural dynamics. In some culture and in this part of the country, drug use is part of the activities that it is prevalent in that culture. Like some see it as a spiritual things, like using snap, which is an alcohol, for spiritual purpose. All these cultural, and in places like Kasina, we see high use of tobacco. It is a norm there for individual in that society to use tobacco. There's also the peer pressure is also a significant driver among adolescents. And as we see later on, most of the condition I'm going to discuss affect the child and the adolescent age group. So the glamorization of drug use in media and music also influence youth substance use behavior. Another factor that can predispose an individual to using substance is psychological factor, which could be in the form of trauma that individual go through maybe as a child. An individual to use drug as a form of self-medication. People suffering from depression using alcohol to as a form of self-medication or to cope. However, not knowing that alcohol on its own is a depressant, which at the end of the day further worsen the condition. Also, youth with low self-esteem are at greater risk of substance abuse. The consequences of drug use in our society, in everywhere in the world and in the society, could include health effects. I will just talk about it briefly. We have physical, like limit cardiovascular disease, the heart problem. It can lead to heart failure, use of tobacco and alcohol, and infectious disease like HIV and hepatitis through sharing of needles for those that use intravenous or intramuscular drug like pentazocine or heroin. The mental health consequence will also occur as a result of using substance. We could have conditions like substance-induced psychosis, and studies have also shown that using cannabis, especially starting in at an early age and using high dose potent cannabis, can predispose an individual to the worst form of mental health problem like schizophrenia. Anxiety disorder and cognitive decline can also follow the use of substances. Then there's also issue with academic and social impact. There's increased truancy, poor academic performance, and dropout rate. And there's also issue of strained relationship and high rate of criminal behavior. Individuals that use substances are not likely to perform well academically, and they are more likely to be a dropout from the society. From the university or the secondary school or primary school, as case issue that could occur as a result of substance. A case still stick to me up to now of a young man I managed, I think about 4 years ago. He came from a well-to-do family, and there are two boys. He was sent to Turkey to study engineering, and his elder brother was sent to UK. The elder brother was not using substance, was able to graduate and became he had masters, he did his master and PhD, and he's doing well. But this young man started using cannabis and tobacco and even alcohol at the age of 9 years. So he has been exhibiting some kind of behavior that is to show that maybe if he was seen by a child and adolescent psychiatric, they could make a diagnosis of conduct disorder, but the parents don't know much about mental health conditions. So he was sent to Turkey. On getting to Turkey, he continued using substances, and he mingled with bad peers, and they introduced him to becoming a dealer in substance, in I think skunk, or you call it skunk cannabis, for a very high. He was introduced to skunk as to be a dealer. So he continued selling skunk. One day, unfortunately, they called the police on them, and he was arrested and sent to 12 years in prison. He spent, I think, around 6.5 years, and he was released as a result of good behavior. This young man now is back in Nigeria. He's not married. He does not have a job, and his father has basically cut enough from the family. So these are some of the issues that could occur as a result of substance use, which could affect individual academic. You can see his elder brother is not using substance, he's a PhD, and he has to be a Democrat and even have a criminal record in Turkey. So another consequence is economic consequences that will occur as a result of using substance, which could be a lot of productivity and increased burden on healthcare system. There's also rising costs associated with law enforcement agency and rehabilitation program like the NDLEA. Then I will talk briefly about disruptive behavioral disorder. These are characterized by persistent pattern of deviant, aggressive, and socially unacceptable behavior. We have two types: the milder form, which is oppositional defiant disorder, and a more severe form, which could predispose to another more severe form of personality disorder, which is known as conduct disorder. So, epidemiology of this disorder in Nigeria, we don't have, there's limited data, but studies put it at around 10 to 15%. Higher rates of this condition are observed in socio-economically disadvantaged environment and also in the urban area. The risk factor for developing disruptive development behavioral disorder include biological factors like genetic predisposition and abnormality in neurotransmitters of the brain, the chemical that the brain used to communicate with each other. Having a parent that have history of this disorder or using substance can predispose a child to having the condition. There's also perinatal complication, which make complication during pregnancy in the form of exposure to neurotoxin. If you have a pregnant mother that is abusing alcohol, it could predispose, alcohol is a neurotoxin, it could predispose the child to developing this condition as a young age. There's also family and social environment in the form of poor parental supervision and inconsistent discipline. Also, exposure to domestic violence and community violence can predispose an individual to developing this condition. So I'll talk briefly about conduct disorder, which is the more severe form of these disorders. Conduct disorder are characterized by a repetitive and persistent pattern of antisocial, aggressive, or deviant behavior that violates age-appropriate societal norm. This disorder is mostly the manifestation, the features of this disorder will depend on the age and stage of the child. It could occur before the age of 10 or above the age of 10, but mostly before the age of 18 years. So the symptoms, the features that individual that have a child that have conduct disorder will be exhibiting will include aggressive behavior and cruelty to people and animal. You have a child that is always stoning animal, always breaking animals, always trying to kill small animal without any justification. There's also destruction of property and bullying others. Also, the child could also prevent with features like deceitfulness, lying, blaming others, and also theft or stealing at home or in school. There's also symptom of like fire setting. The child with conduct disorder derive pleasure in setting things on fire. There's also truancy or running away from home, and also severe provocative or disobedient deviant behavior that the child could be exhibiting. There's also, the child could also have features like forced sexual activity, especially when they are older, or use of weapon. This behavior should significantly impact the family the relationship, and school. And this behavior are manifested not only in one setting. It is manifested at home, it is manifested when this child is in school, and also this child show this behavior even at work if the child is working somewhere. And it requires a duration of about 6 months to make a diagnosis, and one of the symptoms must be present for the most part in the first in the 6 months before the diagnosis. So this disorder conduct is associated with poverty, low socioeconomic class, overcrowding, homelessness, social isolation, high rate of deviancy, truancy, and unemployment. Also, parental criminality is also a risk factor. It's an association to having, for a child to having conduct disorder. A parent that have a psychiatric diagnosis like schizophrenia or bipolar affective disorder can predispose the child to having conduct disorder. Also, use of substances by the parent, and also inconsistent and critical parental style, parental conflict, domestic violence, and child maltreatment. Like I mentioned earlier, the maltreatment could be in the form of physical or psychological abuse, or even sexual abuse. The child in the child possible risk factor for the child developing conduct disorder could include genetic inheriting a gene for the disorder, perinatal complication, like I mentioned earlier. So, what are the causes of an outcome of this disorder? This disorder can be persistent, especially when it started at the younger age group. Many, however, around half of the child will receive a diagnosis of a severe form of personality disorder known as antisocial personality disorder as an adult. And antisocial personality disorder is a disorder that always predisposes a young adult or an adult to criminal justice system, because the individual is always breaking rules, always doing things that push him to having a criminal record. It derives joy from hurting others, and they don't show remorse in the and when they hurt another person. Also, the individual with conduct disorder who progress to having maybe another psychiatric diagnosis as an adult, from obsessive compulsive disorder, major depressive disorder, or panic disorder in adult life. There's also increased risk of early death in children that have, or adolescents that have the diagnosis of conduct disorder. This is often by violent and sudden means. There's also increased risk of social exclusion, poor school achievement, long-term unemployment, criminal activity, and poor interpersonal relationship. So, in trying to make assessment of this condition, it has to be done by a trained healthcare worker, a psychiatrist, or a psychologist, and it will involve taking history from the child, from the family. Also, it's better to establish a very positive therapeutic relationship. Significant percentage might progress to having conduct disorder or having substance abuse as a young adult. What are the ways that we can manage this disruptive behavioral disorder? Management of this condition, no drug has been shown to be effective in managing this condition. Most of the management has to be psychological treatment, from parent management training, trying to change the way the parent relate with the child, and try to change let the parent know what are some things that they are doing at home that can predispose the child to having this condition, like instead of conflicts or the parent using substance. Also, another way that it can be managed is functional family therapy. In severe cases, it will require multi-system therapy, in which you do parent management training, and also the way the child relates in schools also go to the school and the community. But this is very highly resource intensive, but the outcome for this multi-system therapy is very good compared to the other form of therapy. In severe cases, in which the child, especially for conduct disorder, the child has serious aggressive tendency, violating the right of others, medication can be used, albeit for a short period. And if medication is given, the medication is given to control the aggressive behavior in most cases. But after 6 weeks without any improvement, the guidelines say we should withdraw the medication. So we can manage the child with antipsychotic medication. Also, any comorbidity, any condition that co-occur with the disruptive behavior disorder should be managed appropriately. Example is attention deficit and hyperactivity disorder. Then there should be education, there should be a liaison with the school regarding additional support need. Also, we should the managing psychiatry should address child protecting concern, like if there's history of child maltreatment, it should be taken care of. So I will now talk briefly about what are the comorbid conditions. Like I mentioned in the management, we should address them. A youth with conduct disorder can engage in substance abuse as a form of rebellion or seeking thrill, like it's a form of thrill seeking, and it could be as a form of self-medication. Drug use can be used by this child that is having this condition to manage emotional dysregulation. So other comorbidity like I mentioned, anxiety, depression, and learning disability. So what are the impact of this disruptive behavior disorder on the child and adolescent? The impact could be both personal, social, and educational. Personal impact could be poor emotional regulation and high risks of substance abuse, like I mentioned before. Then social difficulties in maintaining relationship and family relationship. There's always going to be an issue with the child that has this diagnosis. They don't obey rules, they don't listen to instructions, they are always trying to go against the standard that the parents set at home, the rules the parents set at home, I mean. Then there's high rate of school suspension and expulsion. So what are the remedies for drug abuse and destructive behavioral disorder? Managing prevention, like I say, as in all form or other form of health problem, prevention they say is better than cure. So in trying to prevent this condition, it will require input from a lot of agency, from the government, from the law enforcement part of the government, like the NDLEA, the police, and also the parent and the healthcare system. So, like I said, education is the key. Prevention is the key. The prevention will start with education and awareness. There's need to develop culturally tailored awareness campaign that target individuals, youth in the society that might be predisposed to this condition, especially those in the low socio-economic strata. And also parental community engagement the parents should be equipped with skills for effective communication at home and discipline. And they should also strengthen community structure to support youth mentorship program. Then on the part of the government, there is need for policy and regulation. There is need for enforcement of stricter drug control, like the good work the NDLEA has been doing, and cracking down on illegal drug markets. There's also need to regulate the sale of over-the-counter medication like tramadol and codeine that in our society now an individual could just go to a pharmacy, a chemist, and request for this even without prescription you'll be given. So there's also need for some individuals that have substance use and disruptive behavior disorder. One of the best form of therapy that can be instituted is psychological intervention in the form of cognitive behavioral therapy. This is effective in identifying and changing an adaptive thought pattern. It helps in building resilience and develop ideal coping mechanism. So rehabilitation programs will also be established, and they should be established, will be used in focus. They should establish youth-focused rehabilitation center which integrate with integration of vocational training. Most rehabilitation center, like what from my experiences, they don't have vocational training, and the problem occur after rehabilitation. This individual, we send them back to the society. They don't have skills. Mostly they are drop out from the society, and they don't have anything to do. They end up becoming an idle, and like the saying go, the idle mind is the devil workshop. So at the end, in the long run, the individual is likely going to go back to substance use. So rehabilitation center should be integrated with vocational training so that the individual can be equipped with necessary skills that will help him later in life and keep him busy, and it will help to reduce youth restiveness. Then policy recommendation, there is need to develop a comprehensive national framework that targets youth drug. There should be the NDLEA should be strengthened for drug enforcement and education. One of this program is a very good program. It helps to educate the society, which is a good move by the NDLEA. There's also need to strengthen the partnership between National Drug and Law Enforcement Agency, educational institution, and non-governmental organization. For disruptive behavioral disorder, this organization should target the primary and secondary school because these are childhood problems, and prevention is better than cure. These children and the teachers should be educated on knowing what to look out for and how to avoid an early detection so that they can refer a child that is exhibiting such behavior before it progresses to using substance. And even a child that is having substance use behavior, it can be identified early before it became a long-term behavioral problem, before a long-term damage can occur to the brain, so that it can be helped through rehabilitation and psychological intervention. Then there is need for increased mental health and educational reform in this country. We need to introduce mental health education into our secondary and tertiary school curriculum, like I mentioned earlier, and also provide scholarship and grant to reduce financial barrier to accessing education. The economic empowerment program could also serve as a good remedy to prevent substance use and disruptive behavioral disorder. We can expand our vocational training and entrepreneurship program, and scholarship could be offered at as a subsidized rate, or we could offer a subsidized employment for we could offer subsidized business for business will be subsidized for youth so that they can employ others and can go into business. There's need to also strengthen health services by establishing specialized clinic for treating comorbid conditions like drug abuse and disruptive behavioral disorder. And healthcare providers should also be trained on how to become youth-friendly so that they can deliver youth-friendly service delivery. As in conclusion, drug abuse and disruptive behavior disorder among Nigerian youth demand urgent and coordinated action. Prevention strategies, effective treatment, and strong policy are necessary to address these intertwined challenges. Collaborative effort by families, community, healthcare providers, and policymakers will ensure that the youth are equipped to lead productive life and contribute meaningfully to national development. I would like to end this talk by giving some of the quotation I normally give to my patients that come with substance use disorder. As we all know, substance use is a chronic relapsing brain disease characterized by compulsive urge to use substance without prescription. So there's a risk of having a relapse in an individual that is having substance. So I normally tell them that recovery is not a risk. You don't have to feel guilty if it takes you longer time than you thought it would be. Addiction is just a chapter in your story, it's not the whole book. And asking for help is a sign of strength, not a sign of weaknesses. Thank you for listening.
All right. Thank you very much, dear Dr. Surajuddin Abdul Kadir, a psychiatrist and a mental health advocate. Indeed, he has played these two roles very, very well the last 40 minutes thereabouts. Thank you once again, Dr. Abdul Kadir, for that brilliant presentation. Indeed, you have shown you are not just a psychiatrist, a mental health advocate, but as well as you have also shown and confirmed that indeed you are an educator. Thank you once again for that brilliant presentation. Addiction or drug dependence is not a book, it itself is just a chapter. So now let's quickly get to recognizing some of our compatriots already on the space. Today, we'd like to appreciate Emiloko of Gold Coast. That's Dr. Adeshuyi. Thank you for being part of this conversation today. Okay, we'd also like to appreciate Prince Eshimokai. Prince Eshimokai, as I often say, he's a regular member of this platform. It's one of us in diaspora based in the US, but then currently serving in Asia. Thank you, Prince Eshimokai, for always finding time to be part of this conversation. Again, I would also like to appreciate Dr. Abdullah, who is also a very senior member of this platform. Dr. Abdullah is of the Ahmadu Bello University Teaching Hospital, Zaria, and also, I think there is a bond, there is a link between him and Dr. Abdul Kadir now, because in Dr. Abdul Kadir's profile, there is the mention of a Mental Health Foundation, and I know Dr. Abdullah joins us from the handle of a Mental Health Foundation, which she has also been using to promote support and bring help for those struggling with substance abuse and dependence issues. All right, we'd also have Mohammed Bafo. Thank you, Mohammed Bafo. Northern Nigeria First. Thank you for being part of the conversation today. Last week we had Dr. Mohammed Ibrahim Gidado. He's right on this space today. Thank you, Dr. Gidado, for being around today. We'd also have Soil Whisperer. Thank you, Soil Whisperer. Winga Daramola. Thank you. Mohammed Abba, thank you, Mohammed. Would also have a new thing worldwide, and I guess that's Ambassador Ken. Thank you, Ambassador Ken. We also have PJ Jane, Dr. West, Agency, Michelle Ofoeju. Michelle is a commander of a strategic command in Tinkan. Ogbeni Oluwole, thank you. One pen at Akmat. Thank you, Akmat, for being part of the conversation today. Bojo, thank you. Ekiti State Command of NDLA, thank you for coming around. Winnie, King Z, Rita Pierre, the Nneka. All right, let's have a pause there, and then we'll come back to recognize more. But quickly, let's get deep into the conversation now that by going into our DM, read some comments and questions. Okay, I have Emiloka of Gold Coast. Please welcome we that are awake in Australia. Okay, yes, absolutely. Emiloka of Gold Coast, that's Dr. Adeshuyi. Actually, you are the first person I recognize. Dr. Adeshuyi joins us from Australia. It's a pleasure to welcome you. I know you are of the time difference, so for you to be awake at this time to join us, we appreciate that. Thank you very much, Dr. Adeshuyi. Okay, who is there? Okay, that's Benga Paul Daramola. Well done to the presenter. All right, thank you, Benga. Dr. Abdul Kadir got your message here. Join the conversation. Well, okay, let's those are just commendations and greetings from our compatriots across. All right, where do we start from? Okay, should I start right on the platform? Okay, I would also like to appreciate all of those joining us on our Facebook platform and also those joining us on our YouTube platform. We appreciate each and every one of you. You are all recognized. Thank you for finding time to join us. Okay, okay, let me start from King Z. King Z. We do want to take the first shot. I should go to our DM, King Z, quickly if you are ready for us.
Yeah.
Okay, please go ahead.
Good evening, Mr. Femi, Baba Femi. How are you?
Very well, thank you. Good evening.
Okay, my name is Mike Obeide. I just want to ask if the agency, the NDLEA, have a database that we can interrogate in terms of what the pervasiveness of this drug abuse. They drug abuse that obviously. I think recently I had a very robust conversation with one of the team member of the agency where I discussed the issues around proper data gathering that can actually form a decision making around forensic psychologies and whatever we want to embark on, social, programs around schools and other aspects of our societies. So I just want to know that, and also, is there any specific program in place by the agency with regards to making drug mandatory for political office holders, drug test
All right.
mandatory for political office holders? Yeah.
All right. Okay, thank you very much there. I believe the two questions from Mr. Michael Bede, they are directly to the agency. So let me step in there and respond. The first is if you are interested in data, that we have a full directorate, that's Directorate of Planning, Research and Statistics, where you can get all the information you need. That you can rest assured about that. Just DM us if you need anything, and we would be happy to provide you the information you need. Then the second one is if there is mandatory drug test for political office. So that's the issue of drug integrity test. As we speak, it's a voluntary thing. We are driving it through advocacy, meaning that the law does not make it compulsory, but there are quite a lot of processes ongoing at the moment. They are quite. This is part of the requirements in a lot of settings, schools, government institutions at the moment. So technically, there are, but then generally, it's not. There is no law making it mandatory, but then it's something. It's a process we've been driving through advocacy to ensure that schools, government institutions, and other sector in the society adopt this as something as part of the strategies to cut down on the demand for drug abuse. And I can tell you that quite a lot of institutions, as we speak, are working with the agency, that is schools and government institutions. Drug testing is going on in a lot of government institutions, including private institutions. And I also know of state governments that have also adopted this as part of the requirements for anyone contesting elections or being appointed into political offices in those states. So all of this, it's going on. That I can assure you. But as far as being in the law, that is not in the law yet. But then, Mr. Moore, you have to mute yourself so that we don't remove you. Please, so that let's be orderly. Mute yourself so that. Thank you very much for that. So I believe that answers Mr. Mike Obeide. In case you need further clarification, please you can also DM us. We'll definitely attend to you on that.
Okay.
All right. Thank you.
I'll reach out to the agency. I will also DM you. And since it's a legislative requirement, I think it will be good if we push for a proper legislation to make it mandatory for certain positions across our government, and also make it mandatory for getting admission into the tertiary institutions. That will be brilliant.
Yeah, that's okay. That's fine. But as I speak with you, I know quite a lot of. but I know also quite a lot of government institutions where we have also led this campaign, including the agency, the NDLA itself. This is something that is ongoing. It's gaining ground, and we appreciate this. And thank you very much for your support in that regard. All right, quickly, let's go to our DM to okay. PJ, Jane, would you want to make a contribution, ask a question from our guest speaker? Otherwise, I'll go to our DM.
Oh, thank you for letting me on. It's not really a question actually, but it's like a contribution to what Doctor has said already. Most of the things I want, most of the things I wanted to say is things that the doctor had said already, like the effects, and everybody here. I'm very, very aware that everybody here is also aware of what we are doing here, and is very much aware of the meaning of drug abuse, disruptive behavior, disorder, and all of that. But like, I feel an area that we are yet to like really, really table is the remedies. It's not just the remedies from the disorder or like the destructive behavior, but like how can we stop the supply of some of all these things that is causing a lot of harm to like our youth. Let me just like come in with a quick story. Universities these days, especially where boys, very deep to see the harm that is going on there. Like most of these boys buy codeine of like 200k, and they are not more than like 4 people in the house. So like the reason I am saying this is because I have experienced it firsthand. And when you get there, you see them put this thing in the fridge, and most of them are taking to like 2 a day. And when you look inside their eyes, when you look at their eyes, the thing is totally yellowish. Like you can tell that these people are harming themselves. You understand? So like the reason I'm saying this is because I feel that there's no enough like even treatment.
Okay, your network is fluctuating. Please quickly wrap up. Your network is fluctuating.
Okay. So what I'm saying is the NDLA should please try to look for how to stop the supply of some of all these things, or make it very, very legal for all these people, for them to afford it. You get what I'm saying? And I wanted to tell you something, you Mr. Babafemi, especially, you understand, but your DM is only for like for only verified account. I wanted you to hear it with your own ears, but only your ears, but is unverified. So it's verified. I don't know how to reach you because I'm not verified. You get? So that is what I'm saying. The NDLA should just help, because if you go to universities, not just primary schools and secondary schools, those ones, they can set up orientation center for them, courses and subjects that they can handle, so that all of them can be aware of how the society is going. But universities, most of them are just damaging themselves there, and the drug intake there is very, very bad. And the NDA, should have that as their avid interest to like try and stop that move. And please, if I can like contact you personally, I want to tell you something else. Please, I don't know how that is possible.
All right, PJ again. That thank you very much. I'll look into that huddle in my DM. But then, if you can reach me, if you also reach the agencies this state, I'm also there. You can rest assured that if you come into the NDLA's DM, you are also finding me there. That I can assure you. So either way you go, whichever one you can access, I'll tell you, you get the same. You can also interact with me right on the handle of the agency. That's that. Thank you once again, PJ Jane. Quickly, let me read this from DM. Thank you very much, Dr. Abdul Kadir, for your presentation. If I get you right, you said conduct disorder is common among young people between ages 9 or 10 and 18. Why? Can you expatiate on this, please? Thank you. That's coming from Babajide. All right, Dr. Abdulkadir. Please, you can.
Okay. Hello. Thank you for the question, Bawajile. Conduct disorder is viewed as a neurodevelopmental disorder. It's a condition that affects solely the children. In psychiatry, there are conditions that affect young people. There are conditions that affect the older age group. But conduct disorder fall under the purview of child and adolescent psychiatry. When an individual started exhibiting, it's just a name given to that disorder. This disorder is not well treated. It can progress to antisocial personality disorder as an adult. But in that age group, less than 18 years, it is called conduct disorder. But anything above the age of 18 years become antisocial personality disorder. And for my presentation, I've listed out the predisposing factor to some of these conditions. Having poor interpersonal relationship at home, poor parental upbringing, history of criminality, among the parents, maybe the father have criminal record or is engaged in crime or engaged in a use of substance, or also the mother is exposed to toxin, also severe abnormality during pregnancy, and a father that has history of criminality can pass that gene onto the child. Then it become an hereditary condition. Then that is the biological factor that can predispose the child to having that condition. Then that with also the socio-economic environment, being brought up in poverty-stricken environment, low socio-economic status, crime, exposure to crime, child abuse in the form of physical or emotional abuse or sexual abuse can predispose a child to having this condition. And it has also been shown that it is a neurodevelopmental disorder in the sense that it occurs early, and abnormalities in the brain is present even at the time that the child, before even the symptoms of the child starts showing symptoms. Abnormality like problem with there's a part of our brain that we use for thinking, for planning, that the frontal lobe, abnormalities in the activity of the frontal lobe, and there's also an emotional part of our brain, the limbic system, particularly amygdala. There's a part of the brain that controls fear or another form of emotion. They call it amygdala. This abnormality in that center has also been shown to predispose an individual to having conduct disorder. So it is named conduct disorder because it is a condition that occurs in childhood. It is under the purview of child and adolescent psychiatry. When this condition persists, as in the violation of people who are the aggression, when it persists into adulthood, the name changes to something like antisocial personality disorder. I don't know maybe if I'll be able to answer your question very well.
Yeah, I believe that should satisfy Babagide. Thank you very much there, Dr. Abdul Kadir. Let's take the next one from, before I come to you, Taiwo Babski. Just get set after this question. I'll come to you. Just hold on. Okay, Taiwo, you can go ahead. Let's just have you once and for all. Let's go. Go ahead, please.
Good afternoon. So,
it's that you have a fan. You have a fan where you are. It's interrupting with your interfering. Or are you depending when you get to a suitable place. Okay, Taiwo. We can't hear you at the moment.
Good afternoon, sir. Good afternoon. So my major point is
we still can't hear you. There is an interference, like a fan is blowing into your mouthpiece.
Okay. Good afternoon, sir. I am listening, sir.
Okay, go ahead now. Fair.
Most organizations and most entities are fighting against like use by not not to people should not be abusing drug society, but still we still have young youths that are still like young youths that are still in the bad manners that cannot even like promote good unity in the society. So my point is that why is it that this our NDLA why can they not like pick all those young people like take them, arrest them, and give them like some books to read in the custody there? That's my point, sir.
Okay, Taiwo, if I get you, like you still have people who are abusing illicit substances, why can't NDLA pick them and keep them in custody? Well, thank you very much for that question. I'll tell you that indeed the agency has is set up by law that an act of parliament and which really outlines what the agency can do and what the agency cannot do. We cannot just pick somebody on the street and lock up the person forever. If we can only arrest somebody in whose custody, in whose possession we find illicit substances, and we cannot lock up the person forever. We just have to, within the time allowed by law, charge the person to court and allow the court to determine the person's fate. But then, for those who are abusing illicit substances, that's whole essence of. There are quite a lot of strategies we're deploying to respond to that. One is just like Dr. Abdulkadir said, trying to raise awareness to let people know that these things are more of danger to their well-being than any good. So try to raise awareness about the danger of abusing these illicit substances so that they can be in a better position to take informed decision when they are faced with that with the temptation to abuse these illicit substances. That is one. The other thing is to also provide support to those who are struggling with this, and I'm sure we did explain this earlier in the program. If you joined us early, that is by providing treatment to those who are struggling with this. This problem, and for those who, and again, we have to go back to the home, the family, the religious institutions, that faith-based organizations, to mobilize all of these stakeholders to get involved in the process, because this is not just about the NDLA, this is not just about the government, it's who is there? You have to mute yourself, Fashola, so that we don't remove you. Please mute yourself until we invite you to talk, please. So like I was saying, Taiwo, we have to deploy a whole of government approach to this, that is working with other government institutions to respond to this, to provide support, and that is in the area of drug demand reduction, as well as a whole of society approach to it, that is also by mobilizing, including you as an individual, to join hands with the agency to ensure that we spread the information, we spread facts, we share facts about the dangers drugs can do to people, so that abstinence, they can abstain from these illicit substances, and in the case they are already fanatizing or having contact or abusing illicit substances, to provide them support early. But I can assure you that we don't lock people up at will. There has to be processes. There has to be certain conditions for that. That's Taiwo, thank you again for your question. Okay, let's have Ibrahim Jajere, please. Ibrahim Jajere, please go ahead.
Good afternoon, everyone.
Good afternoon. We can hear you.
Good afternoon, everyone. Hello. Okay, you can hear me.
We can hear you. Please go ahead. Thank you.
Okay, I first by this first we are talking now. So actually you can mute yourself, please.
I already removed him. Thank you. Go ahead.
Okay, so one of the suggestions I want to bring, sir, the area of this drug abuse is a very wide coverage. It has a very wide coverage in which most of our youth are engaged in this. So you talked about the religious bodies, family as a key factor, and I want to suggest to the agency. I think we need to start from the background educational system. Maybe we have high rate of people starting to abuse drugs from maybe secondary school. I think when we from secondary school, I think NDLA should in which for drug tests students from even when it comes to extent of writing WAEC. From there, a student will have fear of engaging themselves in that particular act because they know that even when they come for GCE, they will undergo a drug test. So that would a little bit create a form of discouragement for our students to begin to engage in that particular act. And they should also put a serious measure when it comes to our tertiary institution. That tests should be from the NDLEA for anybody who is in the institution. I think from that area, when it comes to our educational sector, comparing using our home family and religion cleric, I think we will come a long way in reducing the rates of the high drug illicit abuse from our youths. Thank you very much, sir.
All right, thank you very much, Ibrahim Jajere. Thank you for your contribution. Then I can assure you, Ibrahim, that indeed we are already doing some of it. I'll remove you. I'll remove you again, please. You have to mute yourself. Otherwise, I'll remove you again. Please mute yourself until you are invited to talk. That's where you can unmute yourself. If you interfere with the interrupt our conversation again, I would be very. I'll have to remove you. Thank you. All right. So Ibrahim Jajere, as far as your suggestion, absolutely, you are on point, and I can tell you that all of those processes are ongoing. It's just that because it's not law yet, we have to drive them through advocacy. For now, and even we are taking it. I'm sure in the next. In the next couple of weeks, there is also another thing that the agency is doing with other government institutions, so that in fact we've moved far. We've gone far with the Federal Ministry of Education in the area of drug testing at the various levels of our institutions across the country. But I believe that that will go through very soon. But even at another level again, the agency is also networking, collaborating with some other government institutions, creating a platform where some of the government services can, one of the requirements to obtain some of the government services would have to be this drug. One, to create some deterrence, and secondly, more importantly, to detect early those that are already abusing illicit substances, so that they can get help quickly, not for any punitive measure. Once again, we'd like to appreciate Ibrahim Jajere for those suggestions. That I can assure you that we're already driving some of them, even though through advocacy. All right, so Fashola Potiscom, you can go ahead now, please.
Hello, good evening, all of us, the members of MDLE and other agencies. I stand to support the motion of Ibrahim Jajere, who talk about the improvement of NDLE in terms of giving admission to the student in higher tertiary institution due to the case of drug abuse. Any person that indicted with drugs, let them to go to awareness or let them go to abstain from drugs before he apply into the school. Otherwise, you can see some officers, either in paramilitary and non-paramilitary, they have access uh, to engage youth in terms of drug abuse. So we are calling the attention of the NDLA to securitize again, to investigate, to put down their eyes whatever any kind of this is happening. If you look at how people they can even transfer from one place to another through with drugs, with the power of the security, either some officers they may assist them to escort them and transfer it to somewhere where to go and business about. So we call the attention of the this agency to investigate, to follow all the way throughout the 774 local government in Nigeria. Thank you so much, Mr. Speaker.
All right, thank you very much, Mr. Speaker Potiscom. Please mute yourself now. Your motion is well carried. We appreciate your suggestion and all right. I have to remove Potiscom there. All right, thank you, Potiscom, for your suggestions. They are well noted. All right. Quickly, let's. Okay, Uncle Sam, would you see a contribution, a question?
Yeah, thank you very much. Good afternoon, everyone. Good afternoon, everyone.
Please go ahead.
Yeah, first and foremost, my full name is Aremu Samuelale. I'm so glad to have stumbled on this discussion, and I want to thank the NDLA for the great work doing in kicking out this menace of drug abuse in our society. However, I want to draw our attention or probably ask the NDLA if they are looking into other abuse substances that are not really illicit. Let's take, for example, the energy drink. If you look at, I believe what the NDLA are doing and other sister agencies are doing is to promote public health, to make sure that our society is free from any health degenerating disease and the likes. So I wouldn't know if there's anything the agency is doing concerning abuse of energy drinks. Thank you very much.
All right, thank you very much, dear Mr. Remu Samuel Olale. We appreciate that. I can assure you that the agency, even though that is not under our mandate, but we work hand in hand with other, like you mentioned, other sister agencies, especially in this regard, the NAVDAC. If you follow our activities, you will discover that recently, some weeks ago, in November precisely, we actually signed the memorandum of understanding with NAVDAC, and so we partner with other agencies, both security agencies and non-law enforcement agencies, to ensure that we protect our public health and especially the lives of our people against some of these substances that are socially allowed but are not really good for the health of our people. And I'm sure you would have also followed NAVDAC also doing some work in that regard of recent. But definitely, I can assure you that we would stay on this and continue to partner and collaborate with other agencies to see to this. Thank you once again, Uncle Sam, for that contribution. Okay, let's get back to DNR. Quite a lot to read, and the time is just flying. It's not just running. Okay, let's take this one for Dr. Abdulkadir. Now, this is coming from Eunice. First, appreciating Dr. Abdulkadir for his presentation. He did mention that this conduct disorder is mainly caused by poverty. But I would also like to state that those from good homes or parental background have also suffered this condition. How do we reconcile this? Can Dr. Abdulkadir say something to this, please? All right, Dr. Abdulkadir, did you get that?
I didn't, if I get the question right, although the network was breaking, it's like
Eunice is
he's
saying
trying to know why those from,
yes, why
Hello?
that you attributed this particular disorder mainly to poverty, but that she is now saying that those from good homes or parental background also have suffered from this conduct disorder. How do we reconcile this to your earlier? Yeah, that's her question.
Okay, I get the question now. What I mean by saying poverty is a risk factor, not a direct causative agent. Those from the well-to-do family can also have a child with conduct disorder, especially when there is genetic predisposition to have.
I think we lost Dr. Abdul Kadir there. Dr. Abdul Kadir, we are not here. Okay. Okay. Dr. Abdul Kadir, can you hear me?
I can hear you, but it's shaking.
Yeah,
I don't know. Am I clear to everyone?
It's now we can hear you, but your network went off when you were trying to respond.
Okay. Can I continue now? If everyone can hear me.
Please go ahead.
Okay. So, like I said, even those from the what-to-do family also can. It's not only a thing of those that are suffering from poverty. Even those the high influential part of the society can also have a child having conduct disorder, especially when there is exposure of the mother to toxins during pregnancy. If there is a genetic risk factor, maybe the father has it before, then or it stays once in the family.
Yeah, off again, Dr. Abdul Kadir. I believe the network in your location is not okay. Let me quickly
change.
Okay. Dr. Abdul Kadir, can you hear me? Okay, let me quickly acknowledge some more people where we'll get Dr. Abdul Kadir to stabilize. Thank you, Taiwo.
Can you hear me now?
Okay, you just came back.
Hello?
Your network is fluctuating.
Hello, can you hear me now? Okay. So what I was saying is that it's not only thing that is to the exclusively for those that are living in a poor environment or the disadvantaged part of the society. Those that are living, those the individual that want to do can also have it. Especially, let me just make it short. When you have family self-conduct disorder, genetic factor, exposure of the mother to toxin, parental conflicts, instead of child abuse, all these are all conditions that can predispose the child to having conduct disorder. Parental substance use, be it alcohol or any form of the substance, can predispose to the child to conduct disorder. But it is more represented among the downtrodden, among the poor, because all these factors are listed down.
All right, Dr. Abdul Kadir, thank you for that. I believe your network went off again. Let's quickly come back to just about. Okay, can you wrap that up? Your network went off again.
My network.
But I can hear you now.
You can hear me now?
Yeah, please wrap that up.
Okay, I'll try to change position. I don't know, maybe I'm clear now.
You are here now. We can hear you now.
Okay, so it's not only exclusively to those that live in poverty. Those the high affluent individual can also have a child that develop conduct disorder, especially if all the risk factor is the child is exposed to it. I think that should answer the question. Thank you.
I believe so. Thank you. I believe, Eunice, you are satisfied with the response from Dr. Abdul Kadir there. Let me appreciate, excuse me, Ibrahim Gajere. Thank you for your contribution earlier. Uncle Sam, that's at Remu Samerolale. We appreciate your contribution and your suggestion also. Fashola Potiskum, thank you also. Again, would like to also appreciate drug abuse and illicit sex. Usually joins us that a school, a government college in Abuja here, usually students of a government college in Abuja here usually joins through that handle. Then we'd also have City Boy. City Boy, that's a City of Mobola. Thank you, City Boy of Mobola. All right, let's get to. Okay, I saw Dr. Abdullah. Okay, he went off again. Okay, let's 20 minutes left. Let me quickly take this. Dr. Abdul Kadir. Let's where is Dr. Abdul Kadir? Now see. Okay, his request. Okay, I believe Dr. Okay, I have okay, thank you. Okay, let's quickly hear from Dr. Abdullah. Dr. Abdullah, can you hear me? Okay, if Dr. Abdullah cannot hear me. I believe Dr. Abdul Kadir, you can hear me now?
Yeah, I can hear you now clearly.
All right, thank you very much. Let's. Okay. Dr. Abdullah, can you hear me? Okay, Dr. Abdullah is struggling with his own network there. But then let me quickly read this to you, Dr. Abdul Kadir. This is from Ebon. Ebon is asking what are the differences between normal childhood defiance and a diagnosable disorder? What is the impact on our future? Okay, then I believe the second question from Ebon, you probably have answered it, but let me read it. What is the impact of untreated disruptive behavior disorder on adulthood? I believe you answered that in one of your responses. Please go ahead, Dr. Abdulkadir, if you can hear me. Yeah, Dr. Abdulkadir, can you hear me now? I think Dr. Abdulkadir is trying to stabilize there. But then if you can... Okay. Did you get the question, Dr. Abdulkadir?
Yeah, I didn't get the question. I got the second one, which is something like, what is the long-term consequence of conduct disorder as an adult?
Yes,
I think that's the second one.
Yeah, which I believe you had responded to, but then you can wrap it. But the main question, the first question is, what are the differences between normal childhood defiance and a diagnosable disorder? That's the first question from Ebo.
The difference between normal childhood behavior.
Yes, and childhood normal. What is the difference? What are the differences between normal childhood defiance and a diagnosable disorder?
Okay, normal childhood variance and a diagnosable disorder.
Yes, please. Okay, there, Dr. Abdul Kadir, we can't hear him again. Okay. Dr. Abdul Kadir, can you hear me? Okay, we can hear you now.
It's shaking. It's shaking. Can you hear me clearly?
We can hear you now. Go ahead.
Okay, so some of the symptom features are listed under conduct disorder. A normal child can also exhibit it, but what distinguish a conduct disorder from a normal childhood abnormal behavior is the persistence of the symptoms. If you have a child showing all those abnormal behavior, anger, temper tantrum, deceitfulness, stealing, lying, cruelty to animal, now if you see a child exhibiting those symptoms consistently for up to 6 months, in which at least one of the symptoms is present without doubt for up to that 6 months. We need 3 symptoms to make a diagnosis of a conduct disorder, but at least one of them should be present for.
Okay, you are off again, Dr. Abdulkadir. Yeah, Dr. Abdulkadir, if you can hear me, you are off again. Okay, I believe Dr. Abdullah is coming on now.
Hello, am I clear now?
Okay, you are just back now.
Yeah, it's still shaking when you talk, but I don't know, maybe everyone can hear me clearly.
We can hear you now. It's from your end. Your network is fluctuating.
Okay. Okay, I'm sorry about that. Nigerian factor. So, when you have a child having cruelty to animal and it's always setting things on fire and is bedwetting, you can be sure that child will have a diagnosis of conduct disorder. That those triads, fire setting, cruelty to animal, and bedwetting, is mostly found in the child that have conduct disorder. So, and if they have this abnormality, if they last persistently for up to 6 months, you can be sure that the child has a diagnosable conduct disorder. Is not a normal behavior. A normal behavior, if the child is exhibiting all this abnormal, it shouldn't last for that long. Like with all other mental health conditions, there is always a durational criteria. If you have it for some long duration of period, you can be sure that person has the diagnosable mental health condition. So this will help to prevent labeling a normal child, which is just a deviant or a variant of a normal child from individual that have a.
Abeg, look at it o. Show him. This is what he wants. Let us know. Abeg, look at it o. Show him. This is what he wants. Let us know. Abeg, look at it o. Show him. This is what he wants.
And substance abuse, almost all of them, about 90-something% of individuals that have antisocial that abuse substance. So, and another consequence of conduct disorder, if untreated, is that.
Abeg, look at it o. Show him. This is what he wants.
Especially through violent means, the child can be killed. Maybe he went to steal somewhere, and the people started chasing, and they got angry, and they decided to lynch him. So these are some of the consequences. That's why it is very important for the condition to be recognized early and treated before it progresses to something else, before substance use come into it, before antisocial personality disorder come into it. Thank you.
All right, thank you very much, Dr. Abdulkadir. Let's quickly take the next one before I come to you, Shebuka. I can see you are reacting to Dr. Abdulkadir's statement, but then let's hear from Dr. Abdullah. Dr. Abdullah, if you can hear me.
Oh, yes. Good evening, Mr. Femi and the rest of the.
Well.
Actually, I came because I noticed his network was having problems, so I actually came in to step in case he was unable to come back. So I believe you can proceed since it's much stable now. Thank you.
I appreciate that, Dr. Abdullah. Thank you for always being on hand, always ready to offer support and encouragement. That's very kind of you. Thank you very much once again, Dr. Abdullah. Dr. Abdullah is a very senior member of this platform. He's of the Ahmadu Bello University Teaching Hospital Zaria and is on the handle of Excel Mental Health Foundation. Thank you once again, Dr. Abdullah. Okay, quickly, let's take this one from Chebuka. Chebuka, drop this in. Bedwetting a symptom of conduct disorder? That's putting a question mark. Please, I would love Dr. Abdul Kadir to explain this. Should I be worried as a mother? That's Chebuka. That's from Chebuka. Dr. Abdul Kadir, I believe you got that. She dramatized it in her message. Please go ahead, Dr. Abdul Kadir, if you can hear me.
Maybe his network is giving him problem again. If I may respond.
Please go ahead, Dr. Abdullah.
I think when he said bedwetting, maybe he should have added a context. In conduct disorder, there is something we call the Hellman triangle. There are three symptoms. If they are present, it gives you a very strong suspicion and indication that this child may actually be having conduct disorder. And he did list those symptoms, which is fire setting, cruelty to animal, and bedwetting. Mostly this bedwetting is not like the child is not aware. They do it to annoy either the parents or the caregivers as part of the behavioral problem. It's not the bedwetting other children do unknowingly during their sleep. All right, so there is a difference. Okay, they do these things, to annoy whoever it is that is involved, to kind of cause that pain, inflict that pain. Like he said, they can bully. Of course, if they are living with an adult, they know they cannot bully the adult. They do these things to annoy that adult. So the child may deliberately be bedwetting. All right, set fire to people's properties, cruelty to animals. When these three things are there, and like he said, they have lasted for up to 6 months, then you can almost always be sure that this child have conduct disorder. Thank you.
All right, thank you very much, Dr. Abdullah. Dr. Abdul Kadir, I believe you listened to Dr. Abdullah stepping in for you there. If you can hear me now. Okay, let's take the next question. If Dr. Abdul Kadir is still struggling, I believe Dr. Abdullah will still have to help with this one. That is coming from, where is this? Let me quickly run through. If there are ones that have been taken care of, I'll skip that. How do this other? No, that has been answered. Okay, this is from Comfort. How do parenting styles influence the severity of these disorders? How do parenting styles influence the severity of these disorders? Please, Dr. Abdullah, you can step in for Dr. Abdul Kadir if his network is still not stable.
Should I come in?
Please go ahead. Dr. Abdullah.
Okay. Usually, one of the very important risk factors for these disorders is, like he said, a dysfunctional family dynamics, which include a dysfunctional kind of parenting. In parenting, usually the way we classify different kind of parenting basically into three major types, where we have the laissez-faire kind of parent who doesn't even care whatever their children do. Okay, and then you have the what do you call it, dictatorial kind of parents who are, everything is about punitive measures, beating and stuff like that. These first two I mentioned is actually usually very closely associated with this behavioral disorder. But there is a third type of parenting, which is more democratic. The parents are actively involved, but they also give opportunity to the children to express themselves, and they listen and hear them out, and actually involve them mostly in taking decisions that are in the best interest of the family. All right. So when you adopt a more adaptive parenting style, where the parents are actively involved in the parenting. There is room for discussion. There is room for the children to express whatever their grievances are, and they know that the parents will give them the listening ear and, find common ground. There are consistent rules, and the rules are consistently applied. There is reward system. When the children do well, they are rewarded. There is punishment for misbehavior, and these rules and reward and punishment are consistently applied. You expect that mostly the children will turn out well. But if you don't have this kind of parenting style, whether the parents don't really give much attention to the children, they don't really care much about what the children do, or a parenting style where the parents, is just this kind of, I am the parent, whatever I say is the final. You don't even give room for the child to express what, their own point of view is. You can actually increase the risk of a child developing a behavioral problem. So that is the reason why parenting style is very much mentioned when you are talking about behavioral abnormalities and behavioral disorders in children. So it is important parents realize and adopt adaptive parenting style that is good for the development of the children. Thank you.
All right, thank you very much there, Dr. Abdullah. I think we can only take one more question. Doctor, let me check with Dr. Abdul Kadir if his network is stable. Dr. Abdul Kadir, can you hear me?
Yeah.
Oh,
Hello.
okay.
What, my network is too bad.
Okay,
I don't know.
Dr. Abdullah is actually stepping in very well for you. We have just one more to go. Just one more question. Just hold on. If at least you can hear me now. And this, let's take this last one from Obi Ageli. As a school teacher, I have listened to all of this conversation. My question is, how can schools support students with disruptive behavior disorders? Okay, that's the last question we'll be able to take on this conversation today. Okay, Dr. Abdulkadir, did you hear that? Okay, I believe Dr. Abdullah would have to help for the last time today.
Oh, okay. Yes, as a school teacher, you have a very big role to play in identifying, we say, early identification and early intervention in every, not just mental health problems or behavioral problems. In any kind of problem, early identification and early intervention usually gives us the best outcome. So as a teacher, usually what we advocate is for schools to really give importance to something that has for a very long time been neglected: school-based mental health programs, where not just this behavioral problem, but other mental health problems, substance use disorders are recognized very early, and appropriate interventions carried out to help these children to develop into holistic and responsible adults. So as a teacher, I believe you can encourage your school to adopt or, adapt a school-based mental health programs, get the teachers trained, trained in the way that they are able to identify these problems, early enough. You should have at least professional counselors in the school. If you don't have, you should be able to have some kind of liaison with public health institutions or even private health institutions who have these services available, so that they can actually step in when you do need one. But there is need for proper training of the teachers, school administrators, and other staff in the school, being that the place children spend most of their time outside home is in the school. So the teachers tend to spend a lot of time with these children. So if they are trained on how to identify and pick these salient symptoms of behavioral problems, they will be able to identify that, oh, this child is likely having something like this. And if they have counselors or school psychologists, they will be able to intervene. And if they don't have, they will also should be trained appropriately on how to make appropriate referrals. So there is need for good synergy between schools and parents and the community on how to identify and deal with these problems before they get out of hand. So, in a nutshell, I think our schools need to really look into the adaptation and implementation of these school-based mental health programs, which are supposed to be very comprehensive programs that covers the entire mental health spectrum, on how to help children navigate challenges. And most of these behavioral problems can actually surface when children are having certain stressors, and education can be a stressor, a very big stressor, especially around exams and pressure to perform, pressure to do well. And sometimes this is usually some of the things that lead these children to try out funny things. Somebody will say, if you smoke this thing, you'll be able to read and you'll understand very well. And they just try it and get hooked up. So if teachers are actually trained to recognize these problems, identify them very early, and offer early intervention, we will have, made a lot of progress in this regard. Thank you very much.
All right, thank you very much, Dr. Abdullahi. That's a well-honored and decorated academic and consultant psychiatrist at the Ahmadu Bello University Teaching Hospital. He has stepped in for Dr. Abdul Kadir to help round up this conversation today. We would like to most sincerely appreciate Dr. Dill, a dynamic psychiatrist, educator, and mental health advocate whose career has been marked by profound dedication to improving mental health awareness, access to care, and research in Nigeria. I would like to thank the two of you, gentlemen, for this, for being a very significant part of this conversation today, especially Dr. Suraj Abdulkadir, who is our guest speaker today. We appreciate you most sincerely. That's the most we can take on this conversation today. It's past the hour already. We've been on this for the last 2 hours. We'd like to appreciate all of those that have joined us from Australia, America, London, the rest of Africa, and across Nigeria. Thank you, all of you. We appreciate you for staying awake, waking up early and staying. We appreciate every one of you. Thank you very much. Next week is another time. We'll be back again, and that will be our last conversation for this year. We'll return next January by the grace of God. But next week we're still here. That's the 20th Friday to have the last conversation on this platform for this year. All right, let me also appreciate my colleagues working with me here. That's Rita, Shidi, Musa, Mahmoud, Dele, Francis, in no particular order, and the rest of you guys. I appreciate all of you. Thank you for being a part of this every week. God bless you. Like we often say here, we know it's thank God it's Friday, but then we'd like to remind you that indeed, let's open our eyes. Let's be as moderate as possible. Let's be careful. Let's not put our hands into what will put us in trouble, especially going into substance abuse or all of those related substances. Please, let's especially the new psychoactive substances. Let's avoid all of them. Every one of those things have quite a lot of dangerous effects on. For us to stay healthy, to stay alive, to live long, we have to totally cut off from those things. That's advice from you. From us, from all of us here to you, because depending on these things or coming out of them, it's not really a walk in the park. It's really, that's what we've been discussing. It's a whole lot of challenge to come out of these things. And so that's why we always say it's better not to go into it than to go into it and then now be struggling to come out. That's the most we can take on this. The next week we'll be back with the last episode for this year. Once again, my name is Femi Babafemi, and I'll hand over to my colleague to close the show. Thank you, Mahmoud. Please go ahead.
Thank you very much, sir, for guiding us throughout today's program. That has been Mr. Femi Babafemi, the NDLEA's Director of Media and Advocacy. For more information about NDLEA, you can visit our website www.ndlea.gov.ng. Our social media platforms still remain at NDLEA_Nigeria on X, Instagram, TikTok, and YouTube. On Facebook, it is at NDLEA1. You join us same time next week for another edition of this wonderful program. Bye-bye.
If anybody give you banana, Simba, Sky, Simba, Simba, Simba. If sugar daddy give you cocaine, Simba, Simba, what you cool, Simba. Give you skunk, give you loud, tell you send I want Simba, Chai, Simba, that's how you take Simba. Hey, what's in my eyes, Simba? Simba, what you cool, Simba. No be say, I know they hear when them say, make I stop. Hey, I know fit stop. I swear I want to stop. Somebody help me stop. If anybody give you banana, Simba, Sky, Simba, what you cool, Simba. Hey, whether na school she, Simba, Simba, what you cool, Simba. Banana bastard. Akimuda.